We clean the way that we're supposed to. We clean the best all the time. The only difference was that we were taking whatever supplies we needed into the room with us and closing the door so that we weren't continuously going back to our cart and possibly contaminating anything on our cart. Everything was coming in with us, and when we were taking it out, we disinfected everything. It wasn't just, oh, you're EVS, you're cleaning a patient room. You were EVS and you were disinfecting COVID rooms. So I think it just gave the team a lot of pride, and they took the task very seriously.
You know, I just try to do my best. You know, I mean, I'm sure the patients appreciate it because they tell me.
They get their EVS cleaning carts ready. They go to the first patient room. They knock on the door, introduce themselves. They ask permission to come in and disinfect the room. They would go in, clean all high touch points such as hand rails, doorknobs, light switches, bed rails, telephones. They disinfect the entire room for the patient, pull the trash, mop the floor, disinfect the bathroom, and then they move on to their next room.
When the patients do go home, that's when we really clean the room, like from top to bottom, when they're gone, for the next person that comes in.
They knew that they were important, and I think we just all pulled together really well. We thanked each other a lot. Thank you for coming to work. Thank you for all you do. Thank you for not being afraid, because if people are afraid, nothing gets done. I think that we got a lot of appreciation from nursing and doctors. You care about the people that you work with, and in my mind, this was my family going into these COVID rooms and taking care of these patients, and that was scary. So when they came to sit down to finally catch their breath, I didn't want them to wonder whether their desk was clean or their chair was clean or their telephone was disinfected. That's how we show them love. It's been an experience with everybody coming together the way that they did. It was pretty remarkable, and I think anybody that you would talk to would say the same thing. I can understand that someone would be nervous knowing that we had COVID patients here, but as long as they remember that our #1 goal is to keep them safe, make them feel comfortable, and bring them into a clean and sterile environment, they've got nothing to worry about. Our #1 goal is to connect with people when they come in and make them feel safe. This is the environment for it. I know that this place is safe. I know that we take it seriously. We've always made sure that this hospital was clean and safe for everybody who comes in, and we'll continue to do that.